about the legislature. Remember last year with the aid and dying legislation that passed? And just to be sure you all know, we got nurse practitioners added as one of the providers who can write the prescription for aid and dying. And there is a booth out there with the organization that can give you more information. And I know that you're going to have a presentation on that, I think, on Saturday. Okay, medical malpractice. This was the big bill of the 60-day session. This was the bill from hell. It was the worst political experience that I have had in my decades of lobbying, because it was so vitriolic and so, there was so much anger and there was so much distortion of truth and facts, and it was threats to legislators if they didn't vote a certain way. It was a very bad experience. But the good thing about it was that finally, after trying for, I don't know, 15 years to get nurse practitioners, nurse midwives added, clinical nurse specialists added to the Medical Malpractice Act, because there are many protections in that act, we finally were able to do it in the midst of all of this chaos. And the main reason the bill was revived, this is a bill from 1976 that came about because physicians could not find malpractice health insurance in New Mexico. And the trial lawyers and the physicians groups got together and they created this legislation which puts caps on the amount of liability that a provider can have, and creates a mechanism for patients to be cared for. So we're talking about this because the implementation has happened, and there's already had to be one amendment that happened in the 30-day session to fix the cap. And essentially what it created was a $4 million cap on the hospitals, and for healthcare providers like yourself, it went out from 600,000 to 750,000 cap for independent providers, which are only physicians, advanced practice nurses, I think chiropractors are in there, and maybe a couple others. So now that you're there, I wonder how many of you have taken advantage of the act. So what it requires, right now, any of you who are in independent practice, you're probably getting $1 million, $3 million policy. And what this does is you buy a $250,000 and a $750,000 policy, the cap, the one incident 250, the cap of 750, which is theoretically a cheaper premium, but then you have to buy into the patient compensation fund. You're assessed a fee from the patient compensation fund, depending on what kind of provider you are. And the patient compensation fund is that compromise that says, we're going to limit your liability, provider, but we're going to make sure the patient gets taken care of. And so the care of the patient largely comes out of that patient compensation fund. And that's a simplified explanation of that. So, and we have a member of the Patient Compensation Fund Advisory Group. All right, yes, hi, thank you. We're so glad because the statute said that we had to have that there had to be one nurse practitioner on this primarily physician and trial lawyer fund oversight. And that's the caps I was talking about. It does go up with the CPI. Now, one of the benefits of this, I'm reminding you of why you should probably try to get into this. one of the benefits is that there is a medical review commission made up of your peers, that if you are accused of a medical malpractice, that the people, the lawyers, the people accusing you, they have to present the case to this medical review commission. And the commission looks at all the facts about the incident and decides whether it should go forward to court for a lawsuit. And that you cannot go to court. You cannot bring a civil case against someone in the Medical Malpractice Act without going through this review commission. So that is, now you can go through the review commission, and the commission can say there is no evidence here of a malpractice, and you can still go sue, but you can't sue first. You have to go through this commission, and that commission will also, you know, that will be evidence that there wasn't a malpractice if the commission says there wasn't. Now one of the calls that I got a lot of prior to the passage of this act was a nurse practitioner, a nurse midwife working in a hospital. There's some malpractice occurs. That person that called me, that nurse practitioner, did not do the malpractice. It was like someone else, but you were in the room, and so you were being sued individually, not as an employee. Or of course they're suing you as an employee, but they were also suing you, the trial lawyers were also suing you individually. And there was nothing to prevent that. Even though the hospital would defend you, you would still have to, you should still have to get a lawyer and protect yourself. So this law that was passed in 21 says that if you are an employee of the hospital, you cannot be sued individually. So that is a huge protection and a new one. And that's just what I mentioned about purchasing the policy, occurrence policy for $250, $750, and paying into the patient compensation fund. So what are now the problems? Well, I heard from Rachel that some of you have called, and even if you're not participating in the Medical Malpractice Act, your premiums kind of skyrocketed. Like one of them up to 16%, which is kind of unusual since the number of lawsuits in New Mexico has really not increased. But because of the environment where hospitals now, they used to have that $600,000 cap, and now they have a $4 million cap, and it's going to $6 million in 2026. The outpatient facilities that aren't affiliated with the hospital got that $4 million cap, and places like X-Ray Associates or radiology groups, they came back to the legislature and said in the last session, we can't get insurance. No one will insure us for $4 million. So that was a fix that had to be made. But because now we have an environment where we have a much higher cap on all healthcare, I think that's the reason that regardless of what kind of policy you have, your premiums are going up. Okay, any questions about Med-Mal? Is anybody in the patient compensation fund doing this? That's one of the reasons Rachel wanted me to talk about this, is just to get it out there as an option. Yes. Right.
I renewed in February and never was asked to join the medical malpractice. know what you don't know.
Right.
How do we stay informed? Are we protected? Are we doing enough? Are we in? Are we out?
If you didn't join it, you're out. So that's one of the reasons I'm talking here is to say you have to tell your insurer, okay, I'm now in the New Mexico medical malpractice, I'm covered by the Malpractice Act, and I want that 250, 750 policy. And then you have to go to the Patient Compensation Fund at the OSI to find out what your assessment is. But it's part of the thing is that some of the insurers are not offering the Malpractice Act coverage. But it's theoretically less liability. Well, it's actually less liability for them because that cap is now 250, 750, whereas the policy, the general policy, if you get a claims made policy, is a $1 million, $3 million policy. I mean, it's all complicated, and you have to be the one to say to your insurer, find me that policy, or at least give me a quote on that policy. So you can get the protections of the act. Tell us. Right. Right. Yes, yes, absolutely. That's. And then your and then your carrier is going to tell you who to contact at the Patient Compensation Fund so they can tell you what your assessment.
They should, but they're a business too, and they want your premium.
Yeah, but they're going to get your premium, and the Patient Compensation Fund gets your assessed fee. And your assessment is based on the kind of provider you are. So a primary care nurse practitioner is going to have a much smaller assessment than a cardiac care nurse practitioner or a surgeon physician.
But where do you pay? You write your assessment check too.
It goes to, I think the insurers take it, don't they, and transfer it to the OSI fund?
So, yeah, so you have to get your personal insurance at the $250 level, and then you have your assessment at the company.
But who are you writing that check to? You're writing a check. One to your malpractice insurance.
To the fund, yeah. But your insurer is supposed to know that, and they will know that if you're doing a med mal insure. Well, that's why I think we got to get more info out about it. Yeah.
Those experiences I already had. And of course, it was not about, of course, you have to be concerned because of that. So now I want to keep my insurance. So that's how it's protected. So would I just go to you and give you additional?
No, you have to buy the med mal policy. Yeah, there are insurers that sell the 250, 750 policy. What you probably have now is a $1 million, $3 million policy. And you have a claims made policy, which means when you stop practicing, you no longer have insurance. Whereas if you have an occurrence policy, which the fund requires, then they will pay based on when the incident is, rather than when your insurance ends. Yes, if you have an occurrence policy. Yes, yes. But if you have your $1.3 million claims made policy, when you stop practicing or stop the coverage, you have to buy a tail, a tail policy to cover what could have happened during that time when you were practicing. Insurance is complicated. Or talk to me. Okay, any other comments? Okay, one more presentation. I know you are ready to go. Okay, this is one of our fun ones, the APRN Compact. What do you all know about it? So just think about these questions when we're talking about the compact. And this is a compact that the National Council on State Boards of Nursing is pushing for advanced practice nurses. And as you know, New Mexico is in the RN compact. And we have been in the